So Joel Dunning here on the CTSNet, and we are so delighted to be here with the winner of the competition, the winner of $1,000 for the very best thoracic instructional video. So Edward Kim, thank you so much and congratulations. Edward Kim, together with Lana Schumacher, you're at the Tufts Medical Center, and you submitted an absolute banger. It was a robotic case, but super difficult. I had to sit behind the sofa looking from behind the sofa at it because it was, so difficult at every stage, but you did it so well, really controlled, really safe, and fantastic as a instructional video. So maybe if you could just tell us a little bit of the background of the patient, a little summary, and then just talk us through the case, and then maybe we'll hear a bit more about what you guys do at Tufts.
Thank you so much for the opportunity. It's truly an honor and humbling experience to be selected as this year's competition winner. Dr. Schumacher is my main mentor here at Tufts Medical Center, and I'm a CT surgery fellow, currently going into second year. When I came across with CTSNet, video competition, I thought what would be the better way to showcase our very extensive and involved case that we've done recently. Our video features a 56-year-old with advanced adenocarcinoma who has gone through chemo and immunotherapy. As chemo and IO therapy has become very prevalent throughout the United States, thoracic surgeons across the country are going to come across with these difficult cases, especially your lesion is located in the central hilar region, even more so. Our case was pretty much matted in the hilar region on the left side. And with the help of Dr. Schumacher, we were able to really dig down and deep into the hilar region and utilize intrapericardial opening the pericardium to gain access to the pulmonary artery, and hence have a better control. Our video also features some of the what could be overlooked aspect of preparing for these complex cases is really having a strong communication with cardiac anesthesia, as well as having a perfusion planning with our wonderful perfusion teams. So all in all, I thought this was a great case to showcase for rest of the world.
Yeah, and I think you actually got groin access just in case, didn't you? I think you didn't need it in the end because you got through the case really nicely and got a really great outcome for this case. Obviously, having to go intrapericardial, having to oversew the stump eventually, and a safe outcome. So yeah, it really was a beautiful case. How did the patient do?
Patient actually did quite well. Like you said, we thankfully did not have to utilize cardiopulmonary bypass for this surgery, but having the groin line already in before the patient's decubitus positioning was absolutely critical, given that once the case starts and patient is positioned, it's quite difficult to gain those access. So, and also having all the team members on board, having a team briefing before these difficult cases was also a important part of our surgery.
Yeah, I mean, that's actually a really good point, and probably really good thing to highlight in addition to this video is that planning with cardiac surgeons. So I guess you got some groin access. I mean, I've certainly had to use it on a rather emergency basis in the past when I haven't had access, and it is a nightmare, exactly as you say, those valuable minutes, the chest full of blood. So I guess you had a cardiac surgeon, is that right, ready, and presumably you discussed a plan about what to do if you did get major bleeding. Is that right? And you planned that all in advance?
Yeah. Absolutely. About a week before the surgery, we had a team meeting to discuss about this surgery in detail, so that cardiac surgeons or perfusion teams or cardiac anesthesia team are not surprised on the morning of. And I do think that for absolute best patient care, these are the really crucial aspect to have a better communication in between teams. I think that really helped the better outcome for this patient.
Yeah, fantastic. So maybe tell us a little about Tufts Medical Center and your amazing mentor, Lana. What do you do a lot of these cases? You're already saying that a lot of people getting neoadjuvant, I guess. So yeah, tell us a bit about your robotic program.
Yep. So I started at Tufts Medical Center in 2024, 2025. And I was fortunate enough to work with world-renowned robotic surgeon, Dr. Schumacher. She is an amazing mentor, amazing human being. I was really fortunate enough to really witness all these incredible procedures and all the things that go into preparing for these surgeries. It's such an invaluable experience. Along with Dr. Schumacher, our cardiac surgery team, Dr. Lee, Dr. Zahn, Dr. Sparks, and Dr. Gregory Cooper, our cardiac surgery department is also has been incredible educational experience for me. Right in the heart of Chinatown here at Boston, we are going strong, and I hope to gain more experience as I finish up in my second year.
Yeah, fantastic. And we actually were doing some interviews just yesterday about what makes a great mentor, because we talked to somebody who had been a prize-winning mentor. But maybe tell us a little about what, in your view, makes as on the other side of the coin, so to speak, what makes an amazing mentor? What are you looking for, and what are you so grateful to have received?
I think after training for so long, just coming into cardiothoracic surgery, going to general surgery residency, the main thing that really shaped me as a good surgeon was really the help from all the great mentors that I met so far. The mentors, in my perspective, I think they're truly the parents outside of your family, immediate family. They really do care about how you turn out as a surgeon. Every step of the way, they will look into your progress, will not shy away from giving you a good advice when it's needed. But at the same time, really truly, spending that extra time to really go over things and giving an extra time in the OR to really get through these difficult cases. And I think really what made Dr. Schumacher such a phenomenal mentor was that she had all these. And I am just really, really fortunate enough to have met her and, can call her as my mentor.
And finally, have you got anything else up your sleeve for videos that you might send to CTSNet, or any great cases you've been seeing recently? What else has been going on, and what might you be sending in the future?
Yep, I was thinking about what else I could do. Dr. Schumacher is also a big on foregut as well as esophageal work. I would love to showcase some of her complex esophageal works. For example, we could potentially look into using a conduit that is supercharged with jejunal artery, jejunal branches. I think those are the things that we could potentially look into in the future. But yeah, I'll keep it as a secret until the next year's competition.
Yeah, well, you're gonna be stiff competition for everybody else. So obviously you did absolutely fantastically. So congratulations for myself and everybody at CTSNet. Phenomenal video. Highly recommend people take a look. Really instructional and really well put together as well. So congratulations on the quality of it as well. So from everybody here at CTSNet, congratulations and thank you very much for jumping on the call.
Thank you so much for having me.